Students, today we can study about stomach. This is a diagram of the stomach. Before going to study stomach, we will learn something about the location of the stomach and some introduction regarding the anterior abdominal wall. So this is our stomach abdomen, and here comes our thorax. Here we can see this is the sternum and this is our rib cage. So up to here is the thorax and here comes the abdomen part. So we can see this is our skin. So if we remove the skin, below the skin we can see the superficial fascia. Then superficial fascia, within the superficial fascia there will be fat, then superficial vessels, then cutaneous nerves and all. Okay. Then deep to the fascia there will be deep fascia. Then here we can see the abdomen. On either side there will be a muscular layer. Muscles can be seen under abdominal muscles, and in the central part we can see this white color region. This is known as rectus sheath. This is rectus sheath, and inside the rectus sheath also there we can see one muscle, that is rectus abdominis muscle, can be seen in this diagram. See, here we can see this is the rectus sheath, and if we cut the anterior wall of the rectus sheath we can see rectus abdominis muscle. So this is the rectus abdominis muscle, and deep to the rectus abdominis we can see one more layer of this rectus sheath. Okay, and if we cut this muscular layer, muscles and rectus sheath, everything, we can see another layer of fascia, this one. So this is the rectus sheath. We cut, and if we cut the muscle also, here we can see one more fascia, the white color region. This is known as fascia transversalis. Okay. Then deep to the fascia transversalis we can see a serous membrane, that is known as peritoneum. So peritoneum is a serous membrane which covers the whole abdominal cavity. It covers the abdominal cavity and it also covers the abdominal organs. And in some part of the abdominal organs it forms foldings also. It forms ligaments and are in the abdominal organ. And this is how we are seeing the abdominal cavity after removing the all these structures, that is anterior abdominal wall, muscles, fascia, then fascia transversalis, then peritoneum. So everything if we remove we can see like this structure. Here we can see near the upper part towards the right side there will be liver, and this is gallbladder, and towards the left side there will be stomach. This is our stomach, this one, stomach. And hanging from the stomach we can see a yellow color portion. This is actually a fold of peritoneum, that is known as greater omentum. Okay, here we can see intestines and all. Now we can study our stomach. So we already studied the 9 regions of our abdomen already. So the abdominal cavity is divided into 9 parts by 2 vertical lines and 2 horizontal lines. Which are the 9 regions? At the central part, upper part, we can see epigastrium. Here comes the umbilical region, and this is the hypogastrium. Then on either side here there is right and left hypochondrium, then right and left lumbar region, then right and left inguinal region. Okay, so these are the 9 regions. And for our stomach, we can see stomach is seen in the epigastric region. Here, this is the stomach. You can see the outline of the stomach here. So here it covers the epigastric region, epigastrium, then left hypochondrium, then some part of the umbilical region. So it covers all the 3 regions: epigastrium, left hypochondrium, then umbilical region. Like this it is done. Small part of the right lumbar also, left lumbar also, left hypochondrium, not right, left hypochondrium, then epigastrium, then umbilical region. Then some part of the left lumbar region also. This is the location of our stomach. Then regarding the shape of the stomach, here we can see in a lean person the stomach will be a J shape. A J-shaped stomach. J shape. But in case of an obese person, we can see the stomach is horizontally placed and it has a steer horn appearance. Steer horn appearance. Okay, this one. You have seen these steer horns, that is horns inside the buses and so it will be like that. Steer horn appearance. Okay. Then we can go through the details of the stomach. So this is the stomach. Then external features of the stomach. So this is our liver, gallbladder. Here, this is our stomach. Okay. So stomach has two ends. It has two ends. It has two openings. Then it has two borders. Then it has two surfaces. Okay. So first one, it has two ends. Here we can see there is a cardiac end and a pyloric end. Cardiac end and pyloric end. Cardiac end is continuous with the esophagus. Up to here is the esophagus. So esophagus continues as the cardiac end. Then here in the pyloric end, it will be continuous with the duodenum. This is duodenum. This is pyloric end. And there will be two openings here also. The opening which is continuous with the opening of esophagus, that is cardiac orifice, and here there will be pyloric orifice. Then it has two borders. So in case of stomach, the borders are not straight, so it is curved. Okay. So we will call it as curvature. Okay. So there are two curvatures. One is small curvature, that is known as lesser curvature, and there is a large curvature, that is known as greater curvature. This is lesser curvature and this is greater curvature. Okay. And towards the lower part of the lesser curvature, here we can see there is an angle, or there is a deep depression can be seen, that is known as angular notch. Angular notch. Okay. And to the lesser curvature, we can see there is a fold of peritoneum, this yellow color portion, so that is known as lesser omentum. Lesser omentum. So lesser omentum is seen attached to the lesser curvature of the stomach. This is lesser omentum. Then towards the greater curvature, here we can see greater omentum. Greater omentum can be seen, and towards the upper part, it will be related to gastrosplenic ligament. From here, from the fundus part of the stomach to the spleen, there will be one ligament, that is known as gastrosplenic ligament. Can be seen in the greater curvature. Okay. And surfaces are, this is the antero-superior surface. Okay. And one more surface is the deep to this, that is postero-inferior surface. So two surfaces, antero-superior and postero-inferior surface for the stomach. Okay. And for the purpose of study, the stomach is divided into four parts. Here we can see towards the upper part near to the cardiac end, this portion. This part is known as fundus of the stomach. Fundus. Then the main part of the stomach, this is the body of the stomach. Then coming to the lower part, we can see this is the pyloric part. This pyloric part again divided into two: pyloric antrum and pyloric canal. Pyloric antrum and pyloric canal. So fourth part: fundus, body, pyloric antrum and pyloric canal. So these are the four parts of the stomach. Okay. And then coming to the interior of the stomach. So this is a diagram showing the interior of the stomach. Here we can see this is the inner surface. So interior of the stomach, we can see again the mucous membrane of the stomach is folded. So these foldings are known as rugae or gastric folds. So interior, it is for mucous membrane is folding, and it helps in the increasing the surface area of absorption. Okay. And so this is known as rugae. Okay. And near to the lesser curvature, we can see the rugae are longitudinally placed. See. So longitudinally placed rugae. So they are known as gastric canal. Okay. They are known as gastric canal, or otherwise it is known as magentraceae. Gastric canal or magentraceae. Okay. So this is the gastric fold or rugae. Then here we can see here irregularly we can see, and but towards the lesser curvature, the rugae or the mucosal fold are longitudinally placed. They are known as gastric canal or mesentery. So what is the importance of this is when we are having liquid food, liquids, water and other liquid foods, they will pass us directly through this gastric canal and they will reach us the pyloric end of the stomach. So usually what will happen, we will having this gastric, that means acidic food like soda and all. If you are having this acidic liquids and all, and also liquor, those who are having the liquor, so that will be usually this pyloric part of the pyloric end of the stomach will be having the peptic ulcer. Ulcer will be usually seen in the pyloric end of the stomach, because through this the liquid food passes directly without affecting this part. It will directly go into the pyloric end of the stomach. Okay. So usually the ulcers are seen developed in the pyloric end of the stomach. Okay. So that is the interior of the stomach. Interior. Okay. Then if you are looking into the microscopic view of our stomach, this is a microscopic slide. We are looking through the microscopic anatomy or histology of the stomach. You can see up to this portion is the mucosa. The mucosa, and then below that we can see there is a small space that is known as submucosa. This submucosa. Then below the submucosa we can see the muscular layer. This one, muscular layer, muscular layer. Then below that we can see so this is the microscopic view. Here we can see up to here is the mucosa, and below the mucosa there we can see a small number of fibers, muscle fibers can be seen, that is known as muscularis mucosa. Below that we can see there is a submucosa. This is submucosa, connective tissue layer. Then below that there will be muscular layer, that is muscularis externa, and deep to that comes a serosal layer, that is serosa. Okay, these are the layers of the stomach. Okay, in the mucosa we can see small small pits can be seen. This one, so they are known as gastric pits. Gastric pits can be seen in the mucosa. So this is the histology or structure of the stomach. Sorry, I forgot to tell you about the relations of the stomach. Okay, so this is our stomach. So we already told it has a antero-superior surface and a posterior-inferior surface. Okay, so the anterior relations of the stomach. What are the structures related anteriorly to the stomach? Okay. Then here we already see this is our liver. So liver will come and almost cover this part of the stomach. So anteriorly comes the liver, then above the liver comes the diaphragm. Here we can see diaphragm, and also anterior to all there will be anterior abdominal wall. Okay. So that is the anterior relation, anterior abdominal wall, liver and diaphragm. Okay. These are the structures related to the anterior surface, antero-superior surface. Okay. Then posterior-inferior surface, the structures which are related to the posterior-inferior surface, we will call it as stomach bed, because stomach lies on that structure. So that structures are known as stomach bed. So in this diagram we can see this is the posterior-inferior surface of the stomach. So we are holding the stomach upward like this. Okay. So this is the posterior-inferior surface. And if we hold the stomach like that, we can see what are the structures forming the stomach bed, or what are the structures related to the posterolateral surface. Okay. And here the main structure we can see is our pancreas. This is the pancreas. See, this is the pancreas, and then this one, this is the transverse colon, large intestine. Okay, this is the large intestine, and here we can see more structures. So in this diagram we can see which are the structures. This diagram actually we remove the stomach, like this stomach will come. So after removing the stomach we can see what are the structures related posteriorly. So here we can see this is the pancreas. Okay, and about the pancreas from lateral to medial, this here we can see this is the suprarenal gland. So left suprarenal gland, then below the suprarenal gland this is the left kidney, left suprarenal gland, and this artery is known as splenic artery, which is going towards the spleen, and here comes the spleen. Okay, spleen, then splenic artery, then here we can see this is our aorta, this one is aorta, then here this is our diaphragm. Okay, diaphragm, this is the diaphragm, aorta. Okay. And here we can see there is portal vein. So these are the structures related to the posterior inferior surface, aorta. This is the inferior vena cava. Here comes aorta, diaphragm, left suprarenal gland, left kidney, then splenic artery, then pancreas, then the structures. Then here we can see pancreas. Below the pancreas, here this is the transverse colon, and this is the spleen. Okay, spleen. Then we can see a fold of peritoneum here, which is attached to the transverse colon, that is known as transverse mesocolon. Okay. So these are the structures forming the stomach bed. So once again we'll tell pancreas, then transverse colon, then transverse mesocolon, then colic flexure. This is one flexure, colic flexure. This is spleen. Then here comes the splenic artery, then left kidney, left suprarenal gland. This is the diaphragm, then aorta, then inferior vena cava. Okay. So these are the structures forming the stomach bed. Like this, stomach will lie upon these structures. So these are the postero-inferior relations. Pancreas, transverse mesocolon, transverse colon, spleen, splenic artery, left kidney, left suprarenal gland, diaphragm, aorta, vena cava. Okay, these are the structures which are known as stomach bed. Okay. Then next is the blood supply of stomach. Then blood supply, arterial supply. This by here, this is the greater lesser curvature. Here we can see two arteries, that is right and left gastric arteries. Here this is left gastric artery. Here comes the right gastric artery. Okay, so the lesser curvature, the right and left gastric arteries will supply then towards the greater curvatures. This is the greater curvature. Here there will be gastroepiploic arteries. So right gastroepiploic artery, and here comes the left gastroepiploic arteries. So they will form an arch in the greater curvature. So right gastroepiploic artery and left gastroepiploic artery. And towards the fundus, this is the fundus of the stomach. This fundus of the stomach is supplied by short gastric arteries. Short gastric arteries supplies the fundus of the stomach. Fundus. And near to the cardiac end of the stomach, we can see it is supplied by the phrenic arteries, inferior phrenic artery. So these are the arterial supply. So right and left gastric arteries, right and left gastroepiploic artery, then short gastric artery, then inferior phrenic artery. So these are the arterial supply of the stomach. Okay. Then venous drainage is the corresponding veins, right and left gastric veins, right and left gastroepiploic veins, then short gastric veins. They will be drains the stomach. So this is the diagram showing the lymphatic drainage of the stomach. So the lymphatic drainage of the stomach is very important because of the applied aspect of carcinoma. Carcinoma usually is affecting the lymphatic lymph nodes. So for studying the lymphatic drainage of stomach, it is divided into 4 regions: A, B, C and D. Like this it is dividing. So this is the region A. So here we can see the A portion, it is drains into the left gastric lymph nodes. Left gastric. Here some lymph nodes can be seen. So it drains into the left gastric lymph nodes. Then B portion, this region. So this region drains into the pancreatico-splenic lymph nodes. Pancreatico-splenic lymph nodes. Then area C, this portion which is drains into the right gastroepiploic lymph nodes. Right gastroepiploic lymph nodes. And portion D will be drains into the pyloric nodes and also into the hepatic nodes. Pyloric lymph nodes and also into the hepatic lymph nodes. Then finally, from all these regions, it will be finally drains into the celiac lymph nodes. celiac lymph nodes. That is the final drainage. From all these lymph nodes, finally it drains into the celiac lymph nodes. Celiac. So that is the lymphatic drainage of the stomach. Lymphatic drainage. Then regarding the nerve supply of the stomach is supplied by both intrinsic and extrinsic nerves. The intrinsic nerves are the myenteric plexus. You will be studying in the physiology. So myenteric plexus of Auerbach's or Auerbach's plexus will supply the stomach, and also it is supplied by the extrinsic nerve, that is by the sympathetic and parasympathetic. Sympathetic branch is from the celiac plexus and parasympathetic by vagus. So this is the nerve supply of the stomach. Sympathetic by celiac plexus and parasympathetic by the vagus. Then applied aspect. So mainly we are dealing with the gastric ulcer. So usually ulceration or wound will be seen in the mucosa of the stomach, that is known as ulcer, stomach ulcer or gastric ulcer, and most common site is the pyloric end. We already discussed about the gastric ulcer. It's known as peptic ulcer also. Okay. And also while talking about the lymphatic drainage, we told about the gastric carcinoma of the stomach. Okay. So that also can be seen in some patients, carcinoma. So these are the major diseases or applied aspect anatomy of the stomach. Okay. So that's all about the stomach.